Welcome back, everybody. Let's talk about not sleeping. This is going to be a short one because I'm splitting up two lectures that was insomnia and hypersomnia put together, but it would have been really long. Insomnia is a multifaceted problem that everyone faces at one point or another. Insomnia can mean trouble initiating sleep, which is falling asleep, difficulty maintaining sleep, which is staying asleep, waking up earlier than you want, and it can also mean the deliberate staying up past the appropriate bedtime and having difficulty sleeping without parental intervention if it's a child. There are two forms of insomnia: short-term insomnia, which we might call transient insomnia, and that can last days to weeks. Chronic insomnia refers to the ongoing disturbance, which hasn't ended for months or even years. Short-term insomnia is described by the International Classification of Sleep Disorders as a short episode of trouble falling asleep or staying asleep. For it to be considered a problem, it must be less than 3 months in total duration and must be a severe hindrance to the patient's typical sleeping pattern. Short-term insomnia is not a real hot research topic, mostly because there are so many different things that can cause insomnia. Many medical and sleep problems are cyclical, meaning one problem can exacerbate another problem, leading to a vicious loop. Stress is the number one issue for, or reason for, insomnia, followed by anxiety, environmental disturbances, and then medical problems. I can think of an instance for each of these for insomnia in my own history. I've lost sleep over stress about finding a job. I've lost sleep over anxiety for my sick animals. I've lost sleep because my infant daughter woke up needing nutrition or hadn't been entrained with the circadian rhythm yet. I've had a dry socket in my mouth after a tooth extraction, and that really hurt, and I didn't have anything other than Tylenol for it, and that kept me awake big time. All these reasons were short-term and resolved on their own. That doesn't mean it's not a real symptom or problem, but it's not something you can always do something that will be totally effective. Insomnia is considered chronic or long-term when it has lasted longer than 3 months and manifests into some kind of daytime impairment or distress. There are a few subsets of chronic insomnia. The first we'll talk about is psychophysiological insomnia. Psychophysiological, break it down. Psycho in your head, physiological, that means a normal process of the body, physiological. Psychophysiological insomnia is when a person has become so overwhelmed with problems that they can't sleep. They may even do things to try and help themselves go to sleep, which in turn can make it worse if it doesn't work. Much more wake after sleep onset for these patients is seen frequently. We abbreviate wake after sleep onset as WASO, W-A-S-O. Paradoxical insomnia is also known as sleep state misperception. This is when the patient says they don't sleep at all, but they really do. Or someone who says they sleep all night, but really they were awake all night. Following abrupt cessation of hypnotic use, severe insomnia can happen. Nervousness, intense dreams or nightmares, fragmented sleep, and other psychological symptoms, nausea and tension, physiological symptoms can be experienced. This is sometimes called drug withdrawal insomnia and is particularly common with the withdrawal of benzodiazepines, which have short half-lives, usually less than 4 hours. When I was reverting back to daytime sleep after retiring, working nights, my doctor gave me a prescription for Xanax to try and retrain my circadian rhythm. I didn't even take a whole pill. I would take half, but it would knock me out when I needed sleep. The problem is, when I didn't have it, I had withdrawal issues. I felt like I was having the flu. So those have some serious side effects, and I will probably never take those, even if I'm having real trouble sleeping. They were awful to get off of. When it comes to sleep hygiene, there are several things that a person can do to contribute to their insomnia. Consumption of caffeine, irregular sleep-wake timing, various poor pre-sleep habits, and numerous other factors will promote trouble falling and remaining asleep. Lots of screen time right before bed, or drinking coffee, or Monsters, or Mountain Dew. Um, Especially light on your phone, which tends to be more blue and more bright. That is more uh, wakeful inducing than sedating. There will probably be cases in which there is seemingly no reason for a person's insomnia or condition, and that's why there are usually the exception for all categories, which includes idiopathic. Idio meaning we don't know. Just think about it like we're idiots because we don't know. Unusual sleep spindles can be seen in non-REM 2 and REM, and can contain a few eye movements. REM can contain few eye movements. Although the etiology is not completely understood, an underlying neurological abnormality is suspected. Severity can range from mild to severe, and daytime consequences often include attention or concentration problems, irritability, depressed or anxious mood, daytime fatigue, and memory impairment. The course of this condition is chronic and is not better explained by another sleep, neurologic, medical, psychiatric, or substance abuse disorder. There are other issues that may present with insomnia as a symptom, but they're due to other conditions such as circadian rhythm disorder, psychiatric disorder, or medical conditions and medications. Sleep studies are not indicative for insomnia, unless it is used to rule out another sleep disorder like sleep apnea, which would cause the insomnia. Chronic insomnia can be quantified and qualified through questionnaires and patient self-monitoring, mood and personality assessments, and actigraphy, which observes movements over a longer period of time. That usually gives the physician enough data to try and give them an adequate treatment. That's it for this one. It was very short, but the next one's going to be a little bit longer. Hypersomnolence has a lot more things to do with it, like narcolepsy and idiopathic hypersomnia. It takes a lot more time than just really a insomnia, reason for not sleeping, which there are many, but it doesn't take very long to go over. So we'll see you in the next one for hypersomnia.